Good morning, my dear students. Today we are discussing the life history and pathogenicity of Schistosoma haematobium, which is commonly called it as blood fluke. So, Schistosoma haematobium is a trematode which comes under the phylum Platyhelminthes, which is an endoparasite of a man which lives in the venous plexus in the body or in the different body that in different parts of the body, that is prostatic vesicle and uterine venules, which cause the disease called vesical cystosomiasis or bilharziasis. The parasite is commonly known as vesicle blood fluke. Schistosoma haematobium was discovered by Bilhaz in the mesenteric veins of the Egyptian in Cairo. His work gave the name of the disease, that is bilharziasis, and Leiper identified the snails as the intermediate host of this parasite. So this is present in different parts of Africa, West Asia, Southern Europe, and also it is present in India. So when you are studying the flukes based on their habitat, that is there are different types of flukes, that is blood fluke, liver fluke, intestinal fluke and the lung fluke. So when you come to the morphology of Schistosoma haematobium, so it is commonly called as blood fluke, was present in the hepatic portal system and mesenteric vessels of the man. These are acoelomate, bilaterally symmetrical and somewhat flattened dorsoventrally. So here is the picture of adult worm where you can see the presence of male and female together. So this is an important character of this blood fluke, that is the female lies inside the male. So female, it is about 20 mm long, 0.25 mm thick with the cuticle tubercles confined to end, and the male 10 to 15 mm long, 1 mm thick and covered by finely that is tuberculated cuticle. And there is a presence of oral and the ventral suckers. And there is an important, that is gynecophoric canal, where exactly the female which lives inside that canal. So both the males and the females, they have oral and the ventral sucker, but the ventral sucker of the male is extremely powerful. Digestive system in the either sex is comprised of esophagus and intestine, the pharynx being absent. The life cycle involves a mollusk, that is the snail. Infection in man occurs through skin penetration by the cercaria while walking or swimming in water. See, the life cycle includes, there are three different forms, that is definite host, that is man or human, intermediate host, that is the freshwater snail, and infective form, that is the cercaria larva. So coming to the parasite morphology, the blood flukes form 5 different developmental stages: egg, mycelium, sporocyst, cercaria and the adult worms. So eggs are round to oval in shape, operculate with a sharp terminal spine and contain a developing embryonic larva. So that is what we call it as mycelium. Mycelium or elliptical free-living larval stage covered with cilia. Sporocysts appear as pleomorphic sac-like bodies which contains developing cercaria. So this mature cercaria or elongate free-swimming larval stages which consisting of tapering head, and along with that one important, that is the penetration glands and the forked tail, it is present in mature cercaria larva. The last developmental stage, that is the adult. Adult flukes are elongate tubular worms with rudimentary oral and ventral suckers. Males are shorter and stouter than females. They have longitudinal cleft, that means gynecophoral canal, in which the long slender female lies inside that canal. So next, coming to the life history of Schistosoma haematobium, it is digenetic parasite. That means the life cycle is completed in two hosts. The primary or definitive host is the man, whereas intermediate hosts are certain genera of snails. You know that the nourishment, it is obtained from the blood only. The sexes are separate with well recognizable sexual dimorphism. In male, the ventral sucker is large and powerful. Behind the ventral sucker, the body of the male rolled ventrally to form a groove called gynecophoric canal. During the process of copulation, the female enters the gynecophoric canal of the male in such a way that the anterior and the posterior end of the body of the female projects out of the canal, while the middle part that will be remain enclosed in that canal. It is observed that the female worm do not become sexually mature until they become associated with the males. Occasionally, the female remains permanently associated with her male partner. So soon after copulation, the female becomes ready to lay eggs. She, along with the male, moves against the bloodstream to enter into the small venules of the portal system. Female lay eggs like a chain of beads. When a venule gets filled with the eggs, the worm in the copula migrates to the adjacent venule. The egg started to move through the vessels and enter into the cavity of the urinary bladder to escape with the urine during maturation. The egg may enter into intestine and moves out of the host body through feces in the rare cases. The embryonated eggs are passed with urine and less commonly with stool outside the body of the definite host. If these eggs gain access to water, ciliated Mercedium larva hatches out from each egg. The larvae move freely in water in search of intermediate hosts, which are called as the snails. Intermediate host. The snails acting as an intermediate host. The Mercedium enters into the snail's body by penetrating the soft tissues and ultimately reaches the liver. Inside the liver of the snail, the larva loses its cilia and within 4 to 8 weeks transforms into the sporocyst. The sporocyst multiplies to form a second generation of sporocyst. The daughter sporocyst give rise to forked-tailed cercarial larvae, which are infective stage larvae. A single Mercedium produces 1 lakh to 2,50,000 cercaria. So these cercarial larvae breaks off from the sporocyst and finally makes its way out of the snail body in water. Cercaria freely swim into water for 48 hours, and during this period, if they come in contact with the human beings taking bath or washing with infected water, they automatically penetrate the skin to enter into the body of the definite host. On entering the skin, the larvae cast off their tail and gain access to the peripheral venules, and this stage they are called as schistosomelae. And these schistosomelae are carried to the right heart from where they reach the lungs and moves to left heart and then enters into the systemic circulation. Here is the picture where exactly you can see the eggs, they pass into the water in urine and feces. Rapidly hatched larvae must find a snail within 26 hours to survive. Larvae mature and multiply inside the snail. Worms emerge into water after 3 to 7 weeks, and worms bored through the skin grow to the maturity, then mate in the human body. The larvae take 5 days to reach entering into the host's body. In liver, the larvae mature into adult within 3 weeks from the time of initial infection. The adult male and the female worms move against the blood current to enter into the inferior mesenteric vein, rectal venous plexus and pelvic veins, and finally reaches the vesical plexus of veins. The time taken to reach this stage is 1 to 3 months from the time of entering the infective larvae. After attaining sexual maturity, the worms copulate to repeat the life cycle. Here is the flow chart of life cycle. When the eggs hatch in larva, first stage larva, that is motile ciliated mycelium, that infects the snail. Cilia get shed to become sporocyst. Cell proliferation to form germ balls. Second generation sporocyst. Cercaria formed by sexual reproduction. On maturity, these get escape from parent. Free living in water. Infection by direct skin penetration. Sheds the tail, that is schistosomalae. Enters the peripheral venules. Grow and is sexually differentiated in 20 days in the intrahepatic portal veins, and these reaches the vesicle and the pelvic venous plexus, and they get mature, mate, and they lay eggs. This is how exactly the life cycle repeats in case of blood flukes. Here is the picture where exactly you can see the different developmental stages of, that is the fluke, and along with how exactly it enters to the body of the definite host, and then how it ends with its life cycle. So mode of infection. Infection is acquired while a man is wading, bathing and washing in infected water carrying the cercaria of Schistosoma haematobium. The larvae first stick to the surface of the host skin by their ventral sucker, and as the water begins to evaporate, penetrates the skin and reaches the peripheral circulation. Rarely, the infection may occur due to drinking of infected water. The larvae in such cases penetrate the buccal mucosa to reach the blood circulation. So next it is the pathology. The disease caused by Schistosoma haematobium is known as schistomyosis or bilharziasis. So these are the disease which are having the following characteristics. The toxin or the poison which is liberated by the worm produces symptoms like headache, anoxia, pain in back and extremities, fever with rigor and sweating. The terminal spined eggs of Schistosoma haematobium may erode blood vessels and cause hemorrhages. The presence of eggs inside the blood vessel causes irritational behavior leading to the abscess formation of fibrosis, that is pseudotubercle, around eggs producing inflammatory changes. At the site of the entrance of Sarcaria into host body, itching occurs. That is what we call it as swimmer's itch, a condition called as sarcarial dermatitis. Here is the picture of swimmer's itch. So, some other symptoms which are associated with schistosomiasis are hepatitis, diarrhea, anemia, eosinophilia, or the other symptoms which are associated with this disease. And the last, that is the treatment. There are so many effective drugs, that is dihydroamidine. It is an anti-protozoal agent, and necodine, it is an ointment, and hycanthone, that is the anti-schistosomal activity. And along with that, some of the specific drugs for this disease are trivalent antimony compounds like anthiomalide, that is which decreases the dermatitis and hemorrhages, and tata-emetic, that is helminthic infection, and antimony dimacaptosuccinate. So these are given for the these are the special drugs which are given for the schistosomiasis. So coming to the preventive measures, that is effective sanitary and urinary disposal, prevention of water pollution by human urine and feces, destruction of snails in the endemic areas, avoidance of swimming, bathing, washing in the infected water, and also the treatment for the patient. So these are some of the preventive measures for the disease which is caused by Schistosoma haematobium. Thank you.